Good afternoon, everyone. The topic for today's class is Mechanism of Action of Fluorides. The contents are Introduction, Mechanism of Action of Fluorides, and the references. Introduction. Dental caries is a major dental disease affecting a large proportion of the inhabitants of the world. It impairs the quality of life for many people, causing pain and discomfort. Its very high morbidity potential has brought this disease into the main focus of the dental health professionals. The Federal Register of United States Food and Drug Administration describes fluoride as an essential nutrient. The WHO Expert Committee on Trace Elements included fluorine as one of the 14 physiologically essential elements. These essential elements are required for the normal growth and development of human beings. Fluorine is a member of the halogen family with atomic weight 19 and atomic number 9. It is derived from the Latin word fluoro, means to flow. It is the most electronegative and the reactive of all the elements. In lithosphere, it is present in rocks and soils as fluorspar, fluorapatite, and cryolite. In soil, the fluoride concentration increases with depth. 0 to 7.5 centimeter, the concentration is around 20 to 50 milligrams of fluorides per kg. And in the depth of 0 to 30 centimeter, it is 20 to 1620 milligrams of fluoride per kg. In water, in seawater, it is 0.8 to 1.4 milligram per liter. In lakes, rivers, and wells, it is below 0.5 milligram per liters. Concentration is as high as 95 milligram per liter, which has been recorded in the United Republic of Tanzania. In foods and beverages, in unprocessed food, it is low, 0.1 to 2.5 milligram per kg. In plant, it is 2 to 20 milligram of the dry weight. Leafy vegetables, 11 to 26 milligram on dry weight basis. In fishes, 20 to 40 ppm on the dry weight basis. In air, it is widely distributed in the atmosphere. Dust of fluorides containing the soils is there. Gaseous industrial waste, it is present. Domestic burning of coal fires and gases emitted in areas of volcanic activity. Coming to the mechanism of action of fluorides, it is very important. There are 5 main actions of fluorides. First is increase in enamel resistance or decreased solubility. Second is the increased rate of post-eruptive maturation. Third is remineralization of incipient lesions. Fourth is interference with plaque microorganisms. And fifth is the modification in tooth morphology. First, coming to increase in enamel resistance or decreased solubility. Fluoride reduces the solubility of dental enamel by both systemic and topical action. Fluoride ingested prior to tooth eruption enhances the development of fluorapatite at the enamel surface, and that this fluorapatite is resistant to demineralizing acid that initiate the caries process. The systemic action of fluoride on caries is due to the stabilization of the apatite lattice. Such stabilization is the result of hydroxyapatite having inherent void due to missing of hydroxyl group. Fluoride ions fill this void and add their hydrogen bonding tendency to the forces which have crystal surfaces together. The topical effect of fluoride in reducing enamel solubility occurs during the repeated cycle of demineralization and remineralization in early stages of carious lesion. The presence of low level in plaque leads to gradual establishment of well crystallized and more acid resistant apatite in enamel surface. So this is the diagram. You can see the increase in enamel resistance, how it will cause the acid if it is there, and fluoride if it is present in the plaque fluid. It will penetrate at the surface, absorb the crystal surface and protect from the dissolution. Next is the increased rate of post-eruptive maturation. At the time of the tooth eruption, the enamel is not completely calcified and undergoes a post-eruptive period of approximately 2 years, during which the enamel calcification continues. Throughout this period of enamel maturation, there is continuous accumulation of fluoride as well as other elements in the superficial part of enamel. Fluoride in the solution from the next, so this is how the increase it will cause the maturation, because the fluoride will keep accumulating. Next is the remineralization of the incipient lesions. Fluoride in solution from topical sources enhances the remineralization by speeding up the growth of a new surface on partially demineralized subsurface crystals in caries lesion. The new crystal surface veneer is fluorapatite-like with much lower solubility than original carbonated hydroxyapatite tooth mineral. Subsequent acid challenges must be quite strong and prolonged to dissolve the remineralized enamel. So this is how we can see the remineralization of the incipient lesions takes place with the help of the fluorides. Next is the interference with the plaque microorganisms. Fluoride interferes with the oral bacteria in two ways. In high concentration, it acts as bactericidal, and in low concentration, it decreases the acid production. The fluoride inhibits glycolysis, that is the process by which fermentable carbohydrates are metabolized by kerogenic bacteria to produce the acids. Plaque fluoride can inhibit the production of extracellular polysaccharides by kerogenic bacteria, and this is necessary for plaque adherence to the smooth enamel surfaces. So this is how the it interferes with the plaque microorganism. At high concentration, it acts as bactericidal, and low concentration, it will be bacteriostatic. So fluoride is concentrated within the plaque. It can accumulate in dental plaque at concentration above 100 ppm. Fluoride normally presence in plaque is largely bound, only 2 to 5% being in the ionic form. When the pH of the plaque decreases, that is, acid is produced by plaque organism, the bound fluoride dissociate to ionic fluoride. Thus, when Cary's process starts and acids are formed, the plaque fluoride in ionic form may serve to interfere with the further acid production by plaque microorganisms. Fluoride inhibits enolase, an enzyme necessary for bacteria to metabolize carbohydrates and produce acid necessary to cause demineralization. So this is how it interferes with the plaque microorganisms. Last is the improves the tooth morphology. It has been reported by a number of investigators, although not universally accepted, that posterior teeth form fluoridated areas have a distinct gross morphology, that in such area the cusps are rounder, the fissures are more shallow, and fissure approximation abrupt and tight. In contrast, fluoride deficient teeth have less rounded cusps, steep inclines, and unfavorable fissural approximation. The latter is troublesome because the less well-fused fissures serve as an excellent trap for food debris, bacteria, and bacterial byproducts. So this is the modification in the tooth morphology. Coming to the methods of fluoridation, there are basically two methods. First is the systemic fluoridation, which includes water fluoridation, community water fluoridation, and school water fluoridation. Second is salt fluoridation, milk fluoridation, and fluorides, tablets, drops, and lozenges. Coming to the methods of topical fluorides, the fluorides, they can be applied by dentists or they are professionally applied, which comes in aqueous solution and gels. Aqueous solution, it includes sodium fluoride 2% and stannous fluoride 8%. The technique for application of sodium fluoride, it is Knudsen technique, and for stannous fluoride, it is the Miller's technique. And in the form of gel, it is known as acidulated phosphate fluoride, 1.23% concentration. It is also known as Broodwall's solution. Third is fluoride varnishes, which includes Durafat and Fluor Protector. Then we have fluoride prophylactic paste, restorative materials containing fluoride, and fluoride containing devices. So these are the two main categories of the fluorides. Then for the self-applied topical fluorides, we have the fluoride dentifrices and fluoride mouth rinses. So coming to the summary is that the use of fluorides in dentistry is one of the most successful preventive health measures in the history of dental care. The enamel exposed to fluoride exhibited denser crystals, greater total mineral density, and higher degree of crystallinity, more fluoride, and less carbonate contents. So fluoride is one of the most effective methods, and it is one of the preventive measures for the prevention of the caries. So in the individual or the children having the high caries incidence, the fluorides can be given either in the topical form, which can be applied directly onto the surface of the teeth, or it can be given systemically, which will cause the slow releasing of the fluoride in the blood concentration. So fluoride is one of the most effective measures. So these are the references and the textbook which can be referred for further reading. Thank you.